Hi, everyone. This is a quick introduction to medical coding and goes over just some of the basics that we will be going into more detail over the next few weeks. So, first, what is medical coding? So, what a medical coder does is they take the medical record, whether it's a office visit with soap notes, or if it is a discharge summary, or if it is a surgical report or pathology report. What a coder does is it looks for the procedural and the diagnostic statement that is related to the encounter, whatever the patient was there for. Once those statements are found, and they're usually a couple of sentences, then we go and we use our approved manuals to transition those into codes. And then once we have the codes, we make sure that they are sequenced correctly. And to do that, we have to follow the guidelines that are in each of our manuals. So we're going to go into what manuals are out there and what they are used for. So the first one is the International Classification of Diseases, 10th Revision Clinical Modification, or ICD-10-CM. This manual is going to include diagnosis codes, and the diagnosis is going to be why the patient had an encounter. So if our patient comes to the office and says that they fractured their arm, and then the physician agreed, did an x-ray, saw that the arm was a closed fracture, and then casted the arm. The reason the procedure, the casting, was done is because there was a fracture, the closed fracture. So that closed fracture is the why the patient had the casting done. ICD-10-CM codes are updated October 1st of every year. And the four organizations listed here, AHIMA, NCHS, CMS, and AHA, are all contributors to updating that manual. Next, we have HCPCS manuals. The HCPCS is abbreviation for Healthcare Common Procedural Code Sets. Again, those are going to have procedures, and it is the what occurred to the patient. So going back to my example, I said that a patient came into the office with a closed fracture and that the physician had to put a cast on the patient. So the casting is the what occurred to the patient. These codes are updated January 1st of every year. And we have a couple of different levels. There used to be 3, but there's now only 2. So if you ever hear a level 3 HCPCS code, it's something from way back in the 1990s, early 2000s that were used. They were called local codes. But now we use the HCPCS level 1 codes using the CPT, or Current Procedural Terminology Manual. That manual is maintained by the AMA, the American Medical Association. And then our HCPCS level 2 code manual is maintained by CMS, Centers for Medicaid and Medicare Services. Now, just so you know, there is no alternative name for HCPCS level 2. You will just see a manual that says HCPCS level 2. However, we do not call the CPT manual HCPCS Level 1. We just call that the CPT manual. But I want you to know that both of those manuals are under the umbrella of HCPCS code sets. Then we have one more manual that is not typically used in an introduction to coding course. It is going to be a separate course because it is a different format and different process. But because we're talking about the manuals, I do want to just pop it in here that we also do have an ICD-10 PCS manual. That is the International Classification of Diseases 10th Revision Procedural Coding System. And that's for our facility or hospital coding. And that is also updated October 1st. So anything that says ICD-10, whether it's CM or PCS, is going to be updated October 1st. Anything that's listed HCPCS, whether it's level 1 or CPT, and level 2, HCPCS level 2, those are going to be updated January 1 of every year. And again, ICD-10 PCS coding is a totally different ball game and will be looked at in additional courses. So with that, we really need to know the difference between what an inpatient and an outpatient is. And it's pretty simple that there's just one little term that tells us if the patient is inpatient or outpatient. And that is if we know that the patient has been formally admitted to a hospital, usually meaning that that patient spends the night. So the way that a patient can get admitted to the hospital is through the ER or through they have scheduled surgery, then they're going to be admitted after that surgery for follow-up or for observation, or the physician can just say that that maybe the patient was seen in the office and then he decides that he is going to formally admit the patient to the hospital. That's another way that you would see an inpatient. It's important to review the medical record because, again, we use different codes based on the setting and the procedures that are being completed. So inpatient is always going to use ICD-10-CM for diagnosis codes. In fact, every place uses ICD-10-CM for diagnosis codes. So that's easy. You're always going to use that for diagnosis codes. For procedure codes on the inpatient side, again, you're going to use those ICD-10 PCS codes. And then the way that inpatient is reimbursed is via diagnosis related groups. And again, we'll get into much more detail on these things, but I just wanted to kind of throw these terms out there so when we go into it in more detail, you'll say, oh, I remember hearing that. So then we have our outpatient services, and that's when we have patients that receive services without an overnight stay or are not formally admitted to the hospital. Now, I do preface saying that there is one case in the CPT manual where a patient could be spending the night in the hospital and not formally admitted because they're in observation. There is a observation section that is kind of umbrellaed under the emergency department, but we'll talk more about that when we get into the evaluation and management section in the CPT manual. Again, outpatient, the diagnosis codes are going to come from our ICD-10-CM manual, and our procedures are going to come from the CPT manual and the HCPCS Level 2 manual. Then for reimbursement purposes on the outpatient side, it's via fee for service, capitation, or our relative based RVU system. All right, so I just wanted to put a quick table together so you understood exactly which manual was for which facility and what it described. Again, everything for diagnosis purposes is going to come from our ICD-10 manual. It's for everything: inpatient, outpatient, professional coding, facility coding. Anytime you see diagnosis, you're going to grab your ICD-10 CM manual. Now, the procedures are a little bit different. If you are doing what's called professional coding is the physician's services. Then you're going to use these bottom two, our CPT and our HCPCS level 2, primarily CPT for procedures. If you're coding for facility or hospital or inpatient, then you're going to use the ICD-10 PCS for procedures. Then the last thing that I wanted to touch on, because it is imperative that we start talking about certification early on, is that there are different organizations that certify coders. The AAPC and AHIMA are the two gold standards, and AAPC has the certified professional coder and the certified inpatient coder. They also have additional ones. They have a lot of specialty ones, but those are the two, maybe first ones that you would obtain. And then AHIMA has our CCA and our CCS. The CCA is a certified coding associate and the certified coding specialist. And again, just an introduction. We're going to talk about these in much more detail, both in the reading and in upcoming weeks. So I hope you have enjoyed this semi-quick lecture about what medical coding is. Hopefully it gets you excited about learning coding. And I hope you guys all have a wonderful day, and I will see you in our course.